Okay, so Doctor, nice to see you again. So the LA County Board of Health has approved the restart of the Johnson and Johnson vaccine after looking into um, the issues that had been discovered with it. What can you tell me about the Johnson and Johnson vaccine that makes you think that it is safe to go back to it?
So in our experience, since we began giving the Johnson and Johnson personally at our clinic, we never had anybody with a reaction. And then the data that has been evaluated has shown that only 11 women in more than 80,000 vaccinations that have been given overall have had a reaction. And so for us, with clinical experience, it seems like a pretty safe vaccine. Now, one of the things that we're waiting as doctors and as people who are going to give the vaccine is next week, the CDC is going to have a guidance, a little bit more information for how do we counsel patients regarding this very small risk of clots that could occur in women 18 to 48 years old. And so we're waiting for that guidance on next week.
How minuscule is that number in the overall picture?
So they're saying that, it's 1 in 7 million at this point, 1 in 8 million. Now that there's 11 cases, they're saying that potentially it could be 2 for every million. But the data is still kind of out there. We're waiting to see what's going to happen. Also, the more we give vaccines, the more we are going to encounter some of these women who will have clots. And so the theory behind it right now is that there might be some women who for some reason have some kind of platelet disorder or something in their blood that is causing them to have these clots. And so it doesn't apply to everybody. They have not seen any cases in men, only in women. So more investigation needs to happen. More vaccines need to be given in order to see what develops.
So in other words, there could be some pre-existing conditions among these women that has led to this outcome?
Exactly. And that's what we're thinking, because there really isn't any association with birth control. There isn't any association with anything else. And so the guidance that we're going to receive as medical providers next week is probably going to let us know how do we screen some of these women to try to tease out if they are going to have one of these pre-existing conditions or something in their medical history that could potentially warn us that there could be clots, and then steer those women towards Moderna or Pfizer as a COVID vaccine alternative.
So, Doctor, as you know, there are already people who are opting out of the vaccine altogether. Are you afraid that with what's happened here in the past few weeks with the Johnson & Johnson vaccine, it's going to cause more people to be reluctant to take that vaccine?
I think that, there was definitely an increase in vaccine hesitancy after there was a pause in the Johnson & Johnson. But, you could take it that way, right? And say, oh, it's going to create more hesitancy. It's going to make people more weary of the vaccine. But you should also look at it from the perspective of the CDC, right? If they didn't care about you, if they didn't care about vaccine safety, right, they would have never put a pause on it so that we could investigate. So in essence, you need to have more confidence, right, in the vaccine, because there are people who are looking at the data, they're looking at what's happening, and if anything seems odd or seems like it's going to harm people, we're going to put a stop to it. I think the vaccine has a very good track record of safety. Yes, unfortunately, we had some of these cases where women did get sick, and eventually 3 of them ended up dying, which is horrible. But at the same time, overall, the reason why they are saying we're going to take away. We froze a little bit.
Yeah, you froze a little bit. So just
did we freeze a little bit?
Start back with the fear of. Well, just start with your response again.
Yeah. Somebody's trying to call me, and that's why it's pausing it.
Yeah.
Hopefully, it won't call me back. Hold on. So from the perspective of providers, we look at it, the pause was actually a good thing. It should not create hesitancy in people. It should actually create more confidence, right? That we are looking at the vaccine very closely. We're looking at the outcomes. We're trying to protect people. And so the pause was something that we needed, right, in order to evaluate whether this vaccine is safe or not. And now they're coming back and they're saying that this vaccine is safe. The risk of a clot is very, very small. And we are going to get guidance as to how to guide people on the recommendation of which vaccine is going to be best for them.
Okay. Do you think that people will be more investigative with which vaccine they wind up using? In other words, if they schedule themselves for the vaccine, do you think that more and more people will say, well, Johnson & Johnson's a one-dose vaccine. I like that idea, but with what's happened, I'm going to go with Moderna, or I'm going to go with Pfizer.
In our clinic, we actually had a different reaction. When there was a pause for the vaccine that day, we had over 100 Johnson & Johnson vaccines scheduled. There were a few people, especially in the group of women 18 to 40 years old, who said, yeah, I would like to take another one. But the majority of the people were actually wanting to get the Johnson & Johnson. There was no hesitancy on their part. So I think that there is a subset of people who already made up their mind that the Johnson & Johnson is a safe vaccine and they still want it. I think there's going to still be some demand for it, especially in the groups that were not affected. And so we're hoping that will happen. The one-shot vaccine was a really amazing innovation because it was allowing us to vaccinate people faster, get them to be immune, get them to be protected against COVID. Within 2 weeks, you got to have immunity with this vaccine. So I think that bringing it back now that we know, that it's safe enough and that the potential benefits outweigh the risks, I think that it's a good thing. And as long as we have good enough guidance that we can tell patients, hey, what kind of risk do you have? Yes, this vaccine is okay for you. I think we should be okay.
Wonderful. Doctor, thanks so much. Really appreciate it. You're always there for us. Really appreciate it.
Anytime, Rick. All right. Take care.
Take care.
Okay,
Bye-bye.
Bye-bye.